Well, as we enter a time of rebuilding from the effects of the COVID-19 pandemic, many people are dealing with more than external problems.
Experts are seeing a big impact on high schoolers and their mental health. We're digging deeper into why this is and what people say needs to be done. Being a high school student is hard enough, worrying about keeping your grades up, extracurriculars, fitting in, and then a pandemic hits and everything is amplified. Health experts say teens are dealing with a new kind of health crisis, a mental health crisis.
I've definitely noticed changes in myself throughout, well, basically since COVID hit, and I've seen a decline in people's mental health as an overall.
Meyer, who's a senior and still learning how to navigate high school during a pandemic, is also experiencing feelings of anxiety and depression for the first time.
People losing others at the school, we've had a couple pretty tragic losses within the last year here, and people really struggle with that, and we just need to bring more awareness to it. The National Alliance on Mental Health says high school students with high symptoms of depression are more than twice as likely to drop out than their peers. Among U.S. adolescents ages 12 through 17, 1 in 5 or 18% report the pandemic had a significant impact on their mental health. 1 in 6 experienced a major depressive episode. There was a 31% increase in mental health-related emergency visits, with 3 million people having thoughts of suicide.
Coming back this year, obviously everyone was just excited to be back in full time. But I think what we're learning is that the challenges that go along with that are that during a key point of development, we were all dealing with isolation. And that's led to an uptick in, behaviors and really trying to relearn those things.
It's pretty rare these days to see teens without a phone in their hand, either texting a friend, taking a selfie, and definitely scrolling through social media. Something that is making matters worse because of this new outlet for bullying. One sophomore at Sparta High School and on the wrestling team is not only a victim of cyberbullying, he now feels unsafe within the classroom.
January 11th, I was in DeForest for a tournament.
When Abe received screenshots from a friend showing another student making threats towards him.
He sent me a screenshot. He said he wanted to shoot me, and he said, "I'm tired of this. I'm tired of the way they look at me." He had said my name and that he was going to shoot me.
Threats of violence on social media have posed a different set of mental health challenges. Now high school counselors have to cope with this factor and a deadly pandemic.
Prior to COVID, we've seen the need of mental health services increase. High school's hard, and so students struggle. And then you add everything they've experienced the last couple of years with COVID, and we've definitely seen an increase in the need.
School counselors also emphasize there's no easy fix.
Mental health didn't happen overnight. Things happened and are continuing to happen, and we need to intervene and know that it's going to take time, that there's no quick fix to it, that mental health will take time. It could be months, it could be years, it could be a lifetime.
Abraham and his parents are calling on the school to do more when it comes to bullying.
I think there's a lot of people who are blind to this and who don't know what's really happening until it happens to your child.
But each situation may be different.
Any report that comes our way, we investigate it. And then those investigations look differently depending on the situations. And when needed, we involve law enforcement.
To Abraham and his family, it's about making a change that leaves a lasting impact.
If we can prevent future kids from having to deal with this, or at least the perpetrators getting in trouble when it does happen, that's the legacy to leave.
A legacy for students to feel safe and to spark those much-needed conversations.
I've been there before where I didn't want to talk about anything, just keep to myself, but it helps if you talk to people, and it helps to know that people care about you and they want to help you. And Mike, while I worked on this story, I talked to many different people and asked them what their biggest challenges when facing mental health issues is, and they don't know where to get help.
And speaking of that, here are some local resources. As always, you can find this information at this story on our news app and our website, wxow.com.